If you enjoy working with older adults, think about becoming a gerontological specialist. Gerontology is the study of aging, so the work of a gerontological specialist focuses on the elderly. Gerontological specialists usually work in human service fields such as social work or healthcare. To learn more about this specialty, we spent some time with a gerontological specialist in the medical field.
My name is Beth Wilkie. I'm a registered nurse, and my primary area of specialty is in the area of geriatrics. So I work with seniors. I'm the Director of Supportive Living here at the Shepherd's Care Foundation in Edmonton, Alberta. Working with geriatrics is working with senior citizens between the ages of early 60s right up to 100 and beyond. So it's a very large range of the population. Working within that, you might have those that are very ill and require ongoing care, or you might have those that are well and independent and just once in a while might need advice or guidance or a little bit of help with small tasks. There is a lot of education out there that a person can take to become a specialist in geriatrics. Some of the other formal education that's available, there are many post-secondary programs. I did go back and take one of those after I graduated nursing. It was a combination of palliative care and geriatrics because the two fields are really so connected. Ever since I started nursing, even in nursing school, I just felt a special connection to the seniors that I was working with. Many of the patients that you see in nursing care are seniors. It is a growing area. As a registered nurse with a specialty working with seniors, a typical day might include many things. There is a lot of clinical work. So for example, you might be interacting with a number of different patients. You might be taking their blood sugar. You might be doing a palliative consult for a resident that's possibly at the end of their life. There are a variety of different employment options for a registered nurse or any professional working in geriatrics. The place I've chosen to work is a seniors residence. There's also a lot of work available in the hospitals, out in the community, visiting residents in their homes. There are a number of safety precautions, so you would need protective equipment such as gloves and just universal precautions. Good hand washing, of course, to prevent the spread of influenza. On occasion, you are lifting residents, so learning to protect your back is very important. A typical day would include many different tasks. I would probably start off the day in my office, just checking appointments, checking what may have happened overnight with some of the residents, and then just reprioritize from there. Often I'll go out to several different resident rooms throughout the day. Some of the residents need help with procedures such as checking a blood sugar, just learning how to apply possibly a brace if they've had a fall and fractured something. I'll often consult with the physician if the physician's in and just discuss things that are going on with our residents. There's a lot of phone calls as well from sons and daughters and family members just asking questions about options available. There's certainly a lot of options for seniors care out there, and it's sort of difficult if you're not part of the system to navigate that. So I get asked for advice a lot on the best course of action. We have a number of tools in what we call our toolkit, blood pressure cuff, stethoscope, those are essential items, gloves, any type of nursing equipment needed. Many of the residents have the equipment they need. We have everything from very basic bedside care right up to someone that does research with seniors. So really a wonderful wide range of opportunities. Some of the traits that would make a person a good candidate to work with seniors. First of all, you'd have to love working with seniors. They are a specialty population. They have a lot to teach us, and their needs are also extremely complex. So you really have to have an understanding and a love for working with that type of population. You have to be a really good listener as well. Some of the residents are not able to speak So you have to be able to cue into their verbal as well as their non-verbal cues and be able to interpret that. The hours of work for someone in my area can really vary because residents need care 24 hours a day, 7 days a week. There can be a lot of shift work, and really you're able to choose the work schedule that fits your lifestyle and your family. It's important that you also look at work-life balance in this type of work because you're on the go all the time while you're here. So really you do have to think of looking out for yourself and keeping yourself fit and well. For myself, I'm a runner. I try and run 6 days a week. It keeps me healthy, it gives me a nice mental break, and it gives me the energy that I need to work with the seniors all day. What I would advise if someone is interested in this occupation is to maybe touch base with a nurse or a professional that works with seniors and ask to shadow them for a day. Then you would really see what it's like on a typical day and get a feel for if it's something that interests you and something that you might want to do. The thing that I find most satisfying about my work is something that might seem like a small task or a small visit from me might give that senior the opportunity to help them feel better or to go about their day a little easier. So when I go home at the end of the day and I know that I've truly helped someone or I've truly made a difference, that's really what makes it all worthwhile.
To become a gerontological specialist, you will typically need 2 to 4 years of post-secondary studies. After graduating, you will need additional coursework in gerontology and aging. If the occupation of gerontological specialist interests you, there's more information available, including educational requirements and salary ranges, in the occupational profiles on ALICE. You may also be interested in the related occupations of community health nurse, recreation therapist, or social worker. Learn more on the ALICE website and make the most of your future. Visit us at alice.alberta.ca.